If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question: how can we reduce type 2 diabetes without taking medicines and insulin? Answer by Maura Shannon. If you're a type 1 diabetic, you must have insulin. You can't live without it. If you are a type 2 diabetic, you can successfully manage your diabetes by eating low carb. Cut out sugar, candy, junk food, all breads, etc. Little or no fruit. Eat mainly low glycemic vegetables, broccoli, kale, etc. Not potatoes, and meat, poultry, and fish. Exercise regularly. Lose weight if you are overweight. Intermittent fasting can help keep your blood sugars low. Work with a doctor. Use a blood glucose meter to see if you are successfully managing your blood glucose levels. You may need some medication or insulin to keep your blood glucose at safe levels while you work on your weight, diet, and exercise. Answer by Jane Williams. Thanks for the A2A. But I can't say much that hasn't already been said. As others have said, it depends on whether you're type 1 or type 2. If you're type 1, you can't manage without insulin. No way around it. The fact that you talk about being able to afford it, and your English is good, implies that you may be American. And the American healthcare system is a nightmare that I can't advise you on. That will have to be your main angle of inquiry, unless you can manage to escape to some civilized country where your insulin will be free. Without insulin, you're dead. If you're type 2, this is much less of a death sentence. Again, others have given good advice. Keep your carbohydrate intake low. Beware of processed foods that tend to contain far too much sugar. How to do this in America on a low income is something where a native of that country can probably give better advice. If you can, cook from fresh ingredients. Exercise, if you can. Lose weight, if you can. To deal with a blood sugar spike, if you are type 2 and would prefer to use insulin but don't have it, exercise will burn off the blood sugar, and eating something high in protein and fat will help counteract it. I carry a pack of pork scratchings with me for this. I don't know what would be easy and cheap where you are. Peanuts, perhaps. Be very careful of getting cuts infected, as you're going to find that your immune system is compromised, and any infection will be hard to get rid of. This is one of the main long-term problems with diabetes, loss of feeling in the feet leading to infected cuts that end up with amputation. Catching them early and taking hygiene seriously is the best way. Answer by Yao Tang Yan. The good news is that type 2 diabetes is a highly preventable disease. Well-conducted scientific studies, Diabetes Prevention Program, Dacheng study, have shown that lifestyle modification leading to weight loss can significantly reduce your risk of developing diabetes by up to 58%. And if you're already living with diabetes, don't fret. Let me share with you my 3 simple secrets to a good healthy life that doesn't involve medications or insulin. This is what I've distilled from my years of clinical experience dealing with patients with diabetes. If you do this, you'll significantly reduce your risk of nasty complications. Actually, it isn't really a secret because all of you know this already. Smile. Eating right. There is no special diet for diabetes. You can still enjoy all of the food you like. But, with a big but, everyone with diabetes is different. Do a blood sugar check before eating and 2 hours after your meals. Over time, you'll learn which foods work well for you and which ones are more challenging. And you'll be able to make the right changes that work for you. Moving more. Increasing your exercise levels means that you are using your muscles more often, and in doing so your sensitivity to insulin will increase. This will make it easier for your body to use insulin and to remove excess glucose from your bloodstream. You will see this reflected in low spare blood glucose levels after physical activity. And when I say exercise, I don't mean you need to do the kind of exercise that makes you pant like a dog. Even simple things like brisk walking for 20 to 30 minutes on alternate days, or taking the stairs instead of the lift, help. If you don't believe me, try it yourself. Find one good day, test your blood glucose, take a 20-minute walk, and test it again. Monitoring regularly. Your blood sugar meter shows exactly how diet and exercise affects your blood sugar. It also provides critical information to your care team, so that they can provide a proper diabetes care plan just for you. Record your blood glucose levels, and note whether it is before/after food, exercise and other activities. Remember, you're doing all of this for yourself, and not for your doctor. If you prefer professional guidance to help you along with this, try Glyco. LEAP, a simpler way to lose weight and lower A1C. It's an innovative health program that includes personal health coaching and an interactive curriculum, all delivered on your smartphone. Note, I guide the team that developed GlyGo. LEAP, to ensure that the program is based on sound medical principles.